My name is Padraig O Beirne. I'm the Area Director of Nursing with Cavan Monaghan Mental Health Services. I've been involved with the RE project since its inception. We were one of the first pilot sites to come on board with the original 6 and have worked with the RE project both locally and nationally since then. Organisational commitment is a very, very varied thing depending on where in the country you are and what people are involved in it. In the norm, organisational commitment should look like this is a central core component of what we're trying to do. It should be on the agenda of everybody's meeting. It should be high on the priority list to achieve. And senior managements within the organisation should give leadership in respect of ensuring that this initiative, recovery, touches every corner of the service. Not just at a paper level, but actually permeates the culture that operates within the organisation, so that all staff know that they're working in a recovery-orientated service, but also that they are working to a very specific strategy that is going to achieve a recovery focus. I think when you have service users' voices sitting at the centre of services, at the decision-making processes, then you can get very valid feedback in terms of the type of service model that you're delivering, the interventions that are taking place up and down the services, because remember, these are complex organisations, they're spread wide and varied. So if we have service user representative, family representative at each area of that, we are more assured that we are actually delivering the type of services that people actually want. That has been our experience in Cavan Monaghan as well. I would love to say that the responsibilities on me have lessened as a result of that, but I suppose in reality they haven't. But what they've done is changed. Instead of operating in an organisation that's very much built on a hierarchical model, that the higher you become, the more removed from service users and from the service model you actually become. And now, within a service that is recovery focused and that is open to the people's voices, you're actually interfacing much more regularly with service users and families. That doesn't mean to say that you get to touch with all of the people, but you are getting in contact with representations and hearing those voices on a much more regular basis. I think the other thing that has changed is the responsibility level. I think when you have a recovery-orientated service and where people are empowered to make decisions in respect of their own lives and their own outcomes, I think there's a much better shared approach. And I think when you achieve that better shared approach, the responsibility that's felt by staff and indeed by senior managers is lessened to a degree.